Hello, my name is Amy Daniels, and I am the Unity Health Foundation Development Council Chair. And I'm honored with the opportunity of empowering the strengths of our volunteers in various activities on behalf of the partnership of Unity Health and the community. It's about bringing the community's needs and the needs of healthcare together. It takes visionaries, it takes volunteers raising their hands, and it takes resources from the community. The one central goal we have is to create better healthcare services for our citizens. My first introduction to Unity Health was almost 10 years ago in 2009. I was asked to serve on a committee, then I was asked to join the board, and then I was asked to be the Development Council Chair. It's been a wonderful partnership with all of the amazing leaders, volunteers, and donors. Healthcare has seen so many changes in the last 10 years, and there's been such a tremendous shift in how services are delivered and how services are paid for. It has taken more and more toll on the resources of healthcare systems, and that's why foundations are so important. The foundations of a healthcare system are the voice of the needs of the community. Well, why is that? Because they're made up of volunteers who strive for increasing healthcare excellence. Unity Health Foundation does exactly that. Our Executive Director, Cassandra Feltrop, and her team of 3 work tirelessly to understand the needs of those hospital systems serves, the patients and their families. By partnering with a team of volunteers and asking the community to have a vested interest in their health care, it creates an amazing story. I would like to share my story about my relationship with Unity Health. It started with volunteerism, and when I saw the impact, the stewardship, and the heart of our healthcare system, I knew I could give more. I knew I could do more. When the Cancer Center of Excellence campaign was realized, I, with a full heart, can say I had a part in it. And why was that so important? Well, one, I had a client move all the way from Illinois to take his treatments with Dr. Koch through an oncologist in Dallas for leukemia. He and his wife were able to move closer to their children and have excellent care while he was going through cancer treatments. I had another client through treatments prior to the center's completion, and her husband would sit in my office for several hours while she was administered her chemo. I funded the Appearance Center, which gives cancer patients the opportunity to be pampered and gifted hats, caps, wigs, and such. You know, a place to make them feel beautiful again. I named the room Moxie in memory of my great friend Susan. I cannot drive by the Cancer Center without having a full heart and knowing we have people, our people, being cared for there. Then there was the New Life Center. I named a room on behalf of my son and his first daughter, my first granddaughter. The beautiful thing about the New Life Center is life happens there. Dreams of families begin there. My first grandchild was taken care of by Unity Health, and that was a very joyous gift for me to give. The gift to expecting moms and dads and bringing life into this world. Now we are striving to give our patients transitioning from the hospital to the rehab to have a more rewarding and lovely experience while going through some of the biggest challenges they will ever experience. They come in all ages, genders, backgrounds, needs, and all have their own story. We want to be an empowered and trusting part of their personal story and why they have entered those doors. These are people in great need, and they deserve to have what Unity Health and the community can partner together to give them. They are our family members, our church family, our neighbors, our clients, and we even meet new friends there. This dream of Unity Health in the community is about patient safety. It's about adding robots that thoroughly sanitize a patient room. It is about patient safety handling rooms with the ability to transfer patients safely, not only for the patient, but also for the hospital staff. And it's about upgrading the features of the patient rooms in our rehab so the patient can have care and rest in a beautiful setting that feels less like a hospital room and a little more like a room of peaceful surroundings. So I'm back to my story. This is how I met Unity Health, and this is the work that I've been honored to be able to help do. There's not a month that goes by that I do not know a person or know of a person who enters the doors of our rehabilitation center. They're my clients, they're my friends, and people I know in the community. Now to date, I have personally not had one family member enter those doors, but if I did, how would I want them to have care? A couple of years ago, I was honored to hear Bert Jacobs. He's the co-founder of Life is Good. He and his brother John harked to sell t-shirts on the streets of Boston and now have created this legacy, which we all know of, is Life is Good. We all either own a shirt or we know about their shirts. Bert made a point that will never leave me about successful organizations, and this is what he said. He said, who better to start a foundation than a successful business? All successful organizations should have a foundation and give back to their communities. They should help build and develop their communities, and their communities should rise to the occasion. By the way, every time you buy one of their shirts, they donate 10% to help children in need. But more than that, they empower communities to be better, to use their strengths and their resources to create something amazing. I happen to believe it takes a village. It is all of our responsibilities to ensure we have the best health care we can in our community. I would encourage you to raise your hand, use your strengths and talents, write a check, and most of all, become involved in the needs of health care in our hometown. So I look forward to working with each of you and making sure we make the Patient Safety Campaign a massive success for the patients who rely on all of us and Unity Health, and for the impact it will make on our community as a whole.